Mr. Speaker, I will of course bow to your wisdom, but I believe the word balderdash is parliamentary and it applies to the honourable gentleman's question.
Jacob Rees-Mogg has described as balderdash the claim that the Conservatives have a disgraceful health record in the north of England.
We rarely debate the government's poor treatment of the north, where life expectancy is falling for the first time in a century, but where we've seen the severest cuts of any region to public health service provision. There are now 195 fewer GP surgeries in Yorkshire. We've got the slowest decline in COVID infection rates. And meanwhile, they sent half of the North's vaccine supply down south. And for the autumn break, we know that they cut school meals, free school meals, but hunger, poverty, service cuts and COVID all march hand in hand. So can we have a debate in government time about their disgraceful health record in the north of England?
Mr. Speaker, I will of course bow to your wisdom, but I believe the word balderdash is parliamentary and it applies to the honourable gentleman's question. The government has stood with the North throughout this pandemic, over £10 billion in support for local authorities, additional Nightingale capacity, millions of vaccine doses already delivered, and putting the region at the centre of our community testing plans, with 300,000 people in Liverpool being among the very first to benefit. Looking ahead, we will be building on the £13 billion for transport across the region and £5 billion for the Northern Powerhouse, with HS2, Northern Powerhouse Rail, our multi-billion-pound rail investment, a £4 billion levelling up fund, building on billions of pounds of Towns Fund investments, £4.2 billion local public transport fund, 4 hospitals in or about to start construction of part of our 40-hospital plan. The record of this government in the North is second to none. We are building back better, and we're building back better in the North first.